we as dermatologists see it every day, a disease of almost through the entire spectrum of their life. It's a very important topic to talk about because it's got the physical implications, but also the emotional implications. You want to feel good, you want to have the self-confidence. So that's the immediate part of the reason to treat acne and to take it seriously.
As to why when I'm in my 30s or 40s am I getting acne? Social media is filled with skincare information and with that also a lot of skincare misinformation. As a medical doctor, I see my patients be really confused about what skincare they should be using, what products they should be picking off the shelf, and what products to avoid. Welcome to That Skin Show, because good skin starts with good science. Now, this project has been on my heart for almost 2 years, and finally, with the help of CeraVe and the Roche Posay, we have been able to bring it to life. Over the next 10 episodes, we are going to explore the most common skincare conditions, and we're going to look at the science behind these conditions and how to manage them. But I'm not going to go at it alone. Every episode will have an expert, a dermatologist who is going to come and simplify the science and share with all of you. Our very first episode is about a condition that affects about 85% of the population at some point in their life. It's not only a physical condition, it has a very big emotional burden, and it's something that I'm personally very passionate about. We have an incredible expert on our show today. He is the head of dermatology at the University of Stellenbosch. He has published multiple academic papers, has spoken on international and national platforms, and he is none other than Dr. Visser.
Thank you very
Dr.
much.
Visser, thank you so much for taking the time to come and help us unpack such a really big topic.
Great, thank you. It's wonderful to be with you.
I think as human beings, we connect through stories. And I think each of us has a skin story of some sort. And I'd love to know if you have a skin story and what your skin story looked like.
I was maybe also normal, and I also had acne when I was a teenager. It started more or less when I was in last 2 years of school. And I had acne. I can remember that it was in such a grade that I asked my mother to take me to the general practitioner. And unfortunately, the advice that I then got was, this is normal, don't worry too much about it, wash your face normally and go home. And it probably lasted till first or second year in university.
Sure.
And I think when I look back now, and I look back at some of my school photos, I think I had such a grade of acne that maybe necessitate a little bit of medical treatment. But I think what is also nice to say is maybe I don't have any acne scarring, maybe a little bit of the emotional scarring.
Yes.
But I think that's so important. It's so important to make sure that when you're a teenager, you want to look good, you want to feel good, you want to have the self-confidence. So that's the immediate part of the reason to treat acne and to take it seriously. And then the long-term problems with really permanent scarring that, as you know, is so difficult and so expensive to treat.
No, absolutely.
And even especially in South Africa with people with pigmented skin, that pigmentation that lasts really years. So I think it's a very important topic to talk about because it's got the physical implications, but also the emotional implications.
I absolutely agree. So many years has passed since you've been a teen, and you've obviously become a dermatologist subsequently. If I now walked into your bathroom and opened your bathroom cabinet, what ingredients would I find?
Well, that's a good question. I would say very little ingredients.
That's good to know.
I have a very, very, very mild wash that is actually in my shower. And in my cupboard, I have a good sunscreen, like all dermatologists. And I've also learned that with time. I think when I was a general practitioner, I didn't really expect or know and didn't even think about it. But I use a sunscreen, and I do use the Roche Posay sunscreen, the Anthelios, and the reason is because I don't want something oily on my skin. I still have an oily skin.
Yes.
So the invisible fluid, for instance, from the Roche Posay is just very, very nice for me, and it doesn't make my skin look oily and, shiny.
Too shiny.
Exactly. And then I have a retinol, and that's all. And that I struggle to apply because I forget to apply it at night.
Yes.
But that all, I actually don't even have a moisturizer because my skin is oily.
Okay.
And I use the sunscreen as a moisturizer as well.
Yeah. Well, I think a well-formulated sunscreen can actually act as a moisturizer. And later in the season, we are going to focus specifically on male skincare. And I'd love for us to unpack that a little bit. So as a teen, a lot of us then struggle with acne.
Mm.
Maybe we can just start by explaining, how is this acne formed as a teenager?
Yeah, so I think one concept, and maybe we will get there, is that as you started off by, 85% of people have teenage acne. But it is, we as dermatologists see it every day, a disease of almost through the entire spectrum of your life.
Exactly.
And we increasingly see women in their 30s, 40s, or even later with acne. So I think the principle is that we see acne through our whole life cycle, and that we need to manage it on each of that different stages in a little bit of a different way.
Absolutely.
So teenage acne, and we can say all acnes, has basically 4 important steps of development. And the first thing is the amount of oil that increase. And we see that in teenage years because of that hormonal spurt that we see. So your face gets oily, your hair feels oily, usually in that T-zone that we always say. And that's the first step. But almost parallel to that, you see that in the top of your hair follicle, there's a little bit of keratin accumulating.
Yes.
So that forms a keratin plug. And now you have that increase of oil in the hair follicle. And that gives the environment for some of the microbes to proliferate, and some of them that are a little bit more inflammatory causing, they proliferate more than the others. And then you see the inflammation, because your body picks up on that proliferation and differentiation of the type of bacteria on your skin.
Okay, so
and that causes the inflammation.
the bacteria is then able to thrive in the oily environment, and it is then causing irritation, and your body's saying, oh my goodness, we need to fix something here, and it starts an inflammatory process.
Exactly. And you can almost go through those steps and see all the lesions on your face, the oiliness, the plugs, the black and white heads, the little bit of red papules where the inflammation starts, the pustules, the pimples that are now more inflammatory, and even the cysts. And I think that's the important thing to think, that acne in teenage years look a little bit different than acne later in life. In teenage years, just when you're like 9 or 10, you start seeing the little blackheads on your nose. And there, it's already a good time to start with something.
Yes,
and then you get
introducing that skincare routine,
absolutely,
creating
yeah,
a habit.
That's a very good place to incorporate that skincare routine. And then as you go through your teenage years, you see the full-blown acne developing. And then when you get an adult, then it's totally different. Women get acne in a total different way. The typical adult woman acne is here on the jawline with very deep-seated cyst, with a little bit of pimply going down to the neck even. Yeah.
Absolutely. So that's something I see a lot in my practice, is females who struggle with hormonal acne, and they are always quite surprised as to why, when I'm in my 30s or 40s, am I getting acne. So what is happening to their hormones that is potentially driving this?
Yeah, so I think the 4, let's say, stages that we discussed stays the same, but the triggers are different. So that first, let's say, spurt of your hormones give you the teenage acne.
Yes.
Later in life, there could be some environmental, some barrier dysfunction. Your skin gets a little bit more dry. So that also changes the skin environment. And then in adult women specifically, your skin gets more sensitive to the normal hormone levels that you have. So there's a little bit of change in the hormonal levels. But it's not that if you do a blood test, you're going to see that there's something abnormal with the hormones, because people say, well, go and see somebody for that. It's your normal hormone levels. But the microenvironment of your skin have changed. And also that hormonal, let's say, levels will attack the hair follicle, or your hair follicles becomes more sensitive to that normal levels.
Small fluctuation.
Exactly. And that causes the deeper seated inflammation that we see, and then a pimpliness in a different way and in a different distribution.
Yes. I think Dr. Villy said something very important now, and that is that hormone balancing, or thinking that as an adult female, because you have hormonal acne, something's very wrong with your hormones, is not necessarily true. Those small little fluctuations can actually initiate this process. And seeking proper help is very important quite early on.
And I think that's why the contraceptive pill is sometimes very good to just balance it. It's not making something necessarily doing something different, but just that balancing of the hormones, taking it artificially to a different level. But not everybody can go on contraception, and not everybody prefers that. So we have other methods as well, but that's why the pill will usually help for most females with acne.
Yes, so exactly, we're taking away those tiny little fluctuations. And if you are not a candidate for a oral contraceptive, there are other options. So don't think that that is the treatment that you do need to do. We have other beautiful options where we can still control that little bit of a fluctuation without the contraceptive component.
Absolutely, yeah.
So we've now discussed the hormonal trigger, but is there something else on the skin that's going on? I mean, you briefly mentioned bacteria. Is there a role that bacteria is actually playing?
Yeah, so bacteria, and it's almost becoming more and more involved, and we learn more and more about this bacteria. And you can almost think, we call it the microbiome. So you can almost think of the microbiome of this garden of microbes that are good and a little bit bad, some of them, that lives on your skin, but they live in perfect harmony.
Yes.
And they keep each other's growth under control because they compete for nutrients and so forth. And it's a perfect ecosystem. But then something can happen. As we talked about that hormonal shifts,
Yes.
maybe the environment, maybe some psychological stress. We see your acne flares when you go stress. We see when it fluctuates as you go through your menstrual cycle.
Yes.
Now, something is changing that environment
Okay.
to an environment, especially with the oiliness or the barrier problems, for an environment that is now better for the bad bacteria.
Okay.
And they start flourishing. So to keep to the garden, so they're like weeds that start overgrowing.
Okay.
And they make the good ones less and less. And that's when you get this, let's say, disbalance. And if you get this disbalance in your microbiome, your skin's immunity pick up immediately on that. And that's how we discussed before.
Okay.
Now your skin's immunity picks up on this disbalance, and what it wants to do is it wants to try and fight this disbalance. And then you see the inflammatory cascade that happens. That is the deepest cysts in adults and the typical acne that we see in teenage years.
Okay, that makes a lot of sense. So when we then approaching treatment, we need to kind of look at different aspects of our treatment, right? So we might want to control the hormones. We want to do something about the inflammation, and we want to do something about the microbiome. For the microbiome specifically, is this something that a patient can potentially go and pick off the shelf themselves with good evidence, a good product?
So luckily nowadays there are. So if you look for an acne product specifically that contains some prebiotics or postbiotics or anything that supports the microbiome, it can really help. So it's on an almost more natural way, feeding the good bacteria and boosting the good bacteria to become a little bit more in balance. So any acne product with those type of microbiome support therapy could be a very good choice. And I think your description of thinking through these 4 pillars almost of treatment is very good. So that if you look at even over-the-counter products, to look at products that contain ingredients that can help with the oil balance, that can decrease the oil, that can then secondary also help with the microbiome. And then also help maybe with a keratin plug that's on top. So a little bit of an exfoliating agent. And then in the end, look for something that is anti-inflammatory. So if you can almost get some products that can do both of that. And that's also how we think as dermatologists when we treat with our real good treatment that's available, that we target those pathogenic factors and specifically choose type of products that can target multiple of those specific, factors in the development.
I think you're saying something very important, like you're not looking for a single ingredient to target the oiliness, a single product, because then you're going to end up with a whole range of products. And I'm sure you see it as well. Patients bring a tog bag.
Absolutely.
And they've got all these different products, and we don't necessarily need that. We need a good combined product. So what ingredients are we then looking for? If you're saying we need to unclog the pore potentially a little bit and decrease oil production, what if someone picks up a product, what are they looking for?
Exactly. And I also want to say one thing is it may be that what you need is also different in your acne journey. Like for, let's say, adult acne in a female, you will need more barrier support, for instance, that you will need less of that, and also depending on what treatment you are. But the basic things is for the clogging of the pore, what you need is something that can scale that off a little bit, like salicylic acid or any type of azelaic acid, for instance, but anything that has an exfoliating ingredient that is quite good for a wash as well, because it doesn't stay on that long. But
at a gentle percentage.
Exactly.
And we don't necessarily want a 30% and you're using that as like a toner type of treatment, gentle percentage to keep the barrier intact and not destroy that at the same time. So in a wash is a great example.
And then you can always think about the microbiome, so you can get like ingredients and products that contain microbiome support system. And then also for inflammation like niacinamide, for instance. And then you also need to support the barrier. there's a lot of evidence that even if you have that oily skin as a teenager, there's still this function of your barrier. So you still need to moisturize, something with ceramides, with hyaluronic acid, again, determining the type of skin that you have. And I think what is also very important is these ingredients are very nice for somebody who's starting off with acne. That little bit of skincare routine, which you can start with an over-the-counter product. But as soon as you go on real therapy, so your doctor is now prescribing your medication, then some of these ingredients become less important. Then you don't want to use an exfoliant that is harsh. You want to use the supporting type of products. Like then you go for the ceramides, moisturization, something anti-inflammatory to support. Because I think that intersect between the treatment that you get and the support of what we can get with a dermocosmetic, for instance. That's so important because then we know that we will have that journey of acne treatment, but it is much more bearable. You can control the side effects much more, and patients will then stay on the treatment. So it's really not if I need it type of thing, but it's really almost a must for people to support their skin, especially on treatment. And maybe that gets us to the point is don't continuously use these things if it's not working.
Yes, absolutely. So I think if you've tried to treat your acne at home for about 8 to 12 weeks, if it hasn't improved by that point, you do then need to reach out to your general practitioner or your dermatologist to get a little bit of help. And when you receive that help, I think it's important to make sure that your provider is not just prescribing the treatment and sending you on your way. I think a suggestion of how to change that skincare routine up to something that now is more supportive, that's going to mitigate the side effects of your treatment, is going to make your treatment more successful. I see a lot of patients who abandon treatment because they just feel like they can't cope with the side effects, but it's because the home care never changed. So even if you have acne, it doesn't mean that you just need to use acne products. You might be on a treatment that can push you towards using more skin barrier repair products, more gentle products, nothing too harsh, something with a lot of ceramides, if I'm understanding that correctly.
Absolutely. And I think specifically ask your dermatologist. So you're prescribing me this treatment. Is there something that you would advise me to use in conjunction? You could always say that acne is like a war going on in your face. And we really need good weapons to fight that war. But unfortunately, they do hurt. So you need your dermocosmetics, if you talk about that, as your armor to protect that damage that you constantly get on your skin. And force your dermatologist a little bit to give you recommendations on what to use to support. And if you don't get right there, reach out maybe to the pharmacist. So it is important to make sure that, and if it doesn't work or you don't feel it supports you more than that, then again, ask for other example or something else to use.
Yeah, absolutely. You've mentioned dermocosmetics a couple of times. I think we just have to explain to the audience what they actually are, because when you go into Dis-Chem and Clicks, you stand at that wall and all the products are looking at you and you have no idea where to start. So maybe just if we could understand what a dermocosmetic is, it can help our audience to make better choices.
Yeah, good that you asked that. I think we must understand dermocosmetics as almost the intersect between something I will prescribe on my little prescription pad and just a beauty product. And it's something right in between that we can use as a treatment or we can use it as a support, specifically in acne in a way. And it's usually quite scientifically made up by specific key ingredients that will help with a specific skin concern. So if you have, for instance, rosacea on a very sensitive skin, then it will have products that will calm that inflammation, that will be very much supportive of your barrier. If you have acne, then it can help with the pathogenic factors or all these 4 factors that we talked about, or if you're on treatment, how to support your skin. So almost for every dermatological condition, you need to have some other support to help with the side effects of the treatment. But even if you have eczema, you need a good moisturizer or psoriasis for the active medication to penetrate. So I almost think you can't practice dermatology without that intersect. And I think that's where good scientific evidence and selecting products from companies that you know is backed up by that type of evidence.
Exactly. I think that's very, very important because not all companies spend the same amount of time, finding the correct ingredients, the correct formulation, and then testing it and having good case studies and evidence, to show that it really does work. And those products do exist out there. There are amazing companies that do these types of things. So make sure that you make a good selection. Dr. Visser, to end our episode, which was just jam-packed with information, I would love to know, what is the one thing you really wish every patient that walked through the door of your practice knew?
Yeah, I think especially if you think about acne, I think patients should understand that although it is normal and everybody gets acne, it's really not necessary for you to suffer in silence. I think speak up about it and don't use every product on the shelf before you reach out and ask. I think exactly as you say so correctly, you do that for a month or 2 or 3. And if you see that that is not making a difference, reach out, because the sequelae or the long-term results of scarring and the emotional influence is so big.
Yeah.
And remember also that you are a unique person. And treating acne, as you know, is really not just a paint by numbers.
No.
It's really a unique presentation in every patient. And to get a almost like tailor-made type of prescription and advice routine is extremely important. And be gentle to your skin, be gentle to your microbiome. So use products that are gentle to your skin and work with your skin. And then I think we will get the best results.
Dr. Visser, thank you for sharing your wisdom. I think, I know a lot of this, but I, at the same time, have learned a lot from you today. And I hope that our audience has too.
Thank you very much for having me.
Guys, I think Dr. Visser made such a good point towards the end. Getting a unique, tailored to you routine is really important. Just taking advice off of social media because an influencer is using a specific product does not mean that that product is going to work for you. Make sure that you seek help early so that you can have a unique tailored skincare plan. And that wraps up our very first episode of That Skin Show, because good skin starts with good science.
If you feel overwhelmed by the amount of skincare information online, then hit subscribe as we unpack the science behind the most common skin conditions.